Good morning, everybody. It's um, it's Lisa Salberg, and it is October 29th, 2021, and it is World Stroke Day. And in this segment of Tales from the Heart, a podcast from the Hypertrophic Cardiomyopathy Association, I'm going to do something a little bit different today. And I'm going to share a personal story that I don't really talk about very much anymore. But I think it's important to share this information and to spread awareness because, hey, that's what I do, right? Let's go backwards to go forward, just to keep everybody on the storyline here. I was diagnosed with HCM when I was 12 years old. So basically, my whole life, I had this diagnosis. But I was treated by a local cardiologist. It was the early 1980s. Actually, it was 1980 when I was diagnosed. So there wasn't a lot known about HCM. If there's low knowledge now, there was no real knowledge then, except for among a few specialists. So I didn't really get a lot of information along with my diagnosis, other than the fact that I could die at any moment. There wasn't anything to be done about that in 1980. So things go forward, and I definitely had obstructive HCM. I had an outflow tract gradient of about 90 as a teenager. So I had lots of symptoms related to my HCM that I hid. So if you knew me in high school or junior high, and I would randomly sit down, or I would not walk up the stairs with people, it was because either I was going to pass out or short of breath. And I hid it really well. So I learned how to manage HCM symptoms. But nobody ever warned me about something called endocarditis. For those of you who know what that word is, great for you. But for those who don't, let me bring you along. So there are different types of infections that you can get from different things that you encounter in life. And when you have turbulent blood flow inside of your heart, you are at an advanced risk of developing a bacterial infection, typically, sometimes a strep infection, that lives in your heart and breeds in your heart. Because bacteria like wet, warm places, and what better place than a bunch of blood that's not exactly moving properly. So it's kind of circulating on itself and just becoming a breeding ground. So that's what endocarditis is. The complications of endocarditis can be quite severe. I have a friend battling it right now. It still happens. And you can throw clots. They can land anywhere in your body because you're breaking off pieces of bacterium and they go flying through your body. So that's what endocarditis is. So it's May of 1990. It's a couple of days before my wedding, and I have a killer toothache right up here. It was terrible. I go to the dentist for an emergency appointment, and they do an emergency root canal 2 days before my wedding. Awesome for me, right? Thankfully, I didn't have much swelling. It wasn't a big deal. The procedure went well. I was out of pain. And after my wedding, we took off to California on our honeymoon. While on our honeymoon, I got numbness on my left side. My left hand was numb one day. I had a really bad headache. I was 21 years old and I was on my honeymoon, and I didn't think much of it. Just had a bad headache. Flew home, was driving for those locals. I was on Route 15 up by Sparta, and my left hand went numb completely. I'm like, I probably should see a doctor about this soon. But it was Friday, and I was going home, and I was having some friends over for the weekend, and there was going to be a barbecue the next day. So I was too busy to stop what I was doing and go to a doctor because, hey, there was a party to have, right? So the next day, some friends came over. We played volleyball in the backyard, and I got hit in the head with a volleyball during the game. And it wasn't really hard. It wasn't like some massive volleyball attack. It was just bopped in the head with a volleyball. And I started to slur my speech. And everybody was teasing me that I'd had too much to drink. And okay, it was 1990. I'd had half of a Bartles and James wine cooler. And that was all I had had. So I'm like, I'm not drunk, but I got a really bad headache now. This was on June 15th. We played Pictionary that night. We were really good at Pictionary, my husband and I. So we won. And then I'm like, I'm just going to sleep. And I put my head down and I passed out. My friends left. I was not a very good hostess that night. And my husband encouraged me to go to bed because I was laying on the floor. When I got up, I noticed that I couldn't walk quite right, but I didn't think anything of it. Thank God I woke up the next morning. And by the next morning, my hand was clubbed. I couldn't move it. The side of my face was numb and I was slurring my speech and like something was wrong. I had a neurologist who I was using because I did have migraine headaches. And I called him, I said, something's wrong. So we went to the emergency room. Now we're on June 16th. They thought I had MS. They thought I had an inner ear infection. They didn't know what was wrong with me. Shot me full of painkillers and anti-nausea meds and sent me home. The next morning they called because the blood cultures came back and they realized that I probably had endocarditis. But then they sent me for an MRI to figure out why my hand was doing what it was and why I was numb. And that's when they realized I had had a stroke. So MRIs were not common in hospitals at that time. So it was an outpatient MRI. And they put the doctor on the phone and he said, you need to get over to the hospital. I went to the hospital. I was put on IV antibiotics, blew out basically every vein in my arms, hands. Literally, my last IV was between my toes. And before they put the port in. So that's I believe that's why to this day I really don't have great veins, which was fun through my transplant. So I went through all of that, but it was funny. I didn't realize I had a stroke. I thought I just had some infection and I didn't know why I was numb. So the stroke. Well, I went to the hospital on a Sunday. They brought me back on Monday for the MRI, admitted me. And then on Wednesday morning, a nurse, and if you're out there, thank you, nurse, but it was kind of shocking. She walked into my room on Wednesday morning and said, where's my stroke patient? And I'm looking at the other bed in the room because it's shared rooms and there was an older lady in there. And I said, I think she left. And she laughed. She goes, well, aren't you funny? I'm like, what are you talking about? Who had a stroke? And she's like, oh, honey, that's why you're here. I'm 21 years old, married for 3 weeks. And now this girl's coming in telling me this headache and this arm numbness. I had a stroke. And then everything kind of made sense. Over the next couple of days, I was throwing more clots and I eventually lost part of the vision in my eye. A lot went and some came back, but I'm partially blind in my upper left. So if you'll see me move my head funny sometimes, it's because I don't always see things clearly up here. So I'm always kind of looking to see what's over my shoulder. So somebody said, you flip your hair. I'm like, no, I actually just try to see. That's just what I do. So I'm left with the residual blindness. I'm left with some sensitivity loss on my left side. My left hip is very weak. I've learned to acclimate very well to that. There's a reason why you never see me without makeup because this eye shape is different and I try to normalize them with eye makeup. But I've been doing this for 31 years. So y'all just think this is what I look like. I smile crooked because I'm a stroke survivor. So HCM does more things than cause arrhythmias, does more things than cause heart failure. Sometimes there are other consequences. And this is where I'm going to get an ounce controversial. So at the time of my dental procedure, the doctor should have pre-medicated me by guidelines. And he didn't. I don't think very much of that individual to this day. He told me HCM was a trendy little disease and it really didn't need to be pre-medicated because it was just a genetic heart condition. Like somehow that didn't actually matter to my body, but whatever. So about 10 years ago, there was an update to the endocarditis guidelines on prophylactic use of antibiotics before dental work. And they took HCM off of the list of things that need to be pre-medicated across the board, but leave some space that if you're obstructed, then you could consider pre-medication. So pre-medication is taking a bit of penicillin an hour before your dental work and maybe an after dose an hour after, depending upon how you want to look at the guidelines. So they pulled back and said, you don't have to do it anymore. And I'm starting to see an increase in endocarditis cases in HCM because they thought it went away and it wasn't really a problem. But when you stop treating something and you go back to the old ways, the old problems come back. Turbulent blood flow breeds infection. And HCM hearts have turbulent blood flow for many, not all, but for many. So if you're listening to this, I want you to speak to your healthcare providers about the need for prophylactic antibiotics before dental work. And per the guidelines, use shared decision-making, please, and say, what are my risks for taking some antibiotics before dental work or invasive procedures? And what are my risks of not doing that? Right now, a dear friend is in the hospital going to have surgery on Sunday to replace her valve and clean out the vegetation that the endocarditis is leaving because it's replicating, it's not stopping. So she has to have surgery. And this is, 2021. My stroke was 1990 from endocarditis. And we're still doing this because guess what? She went for dental work and they didn't pre-medicate her, even though she has HCM with obstruction. So please take this as a cautionary tale on Stroke Awareness Day. Strokes come from many causes. Mine was from endocarditis. It could have killed me at the age of 21. Thank God it did not. And I am grateful for science that I'm here today and that the antibiotics worked for me. So it's Stroke Awareness Day. And this is the first time I'm really sharing my stroke story with the HCM community. But this is what happened to me. Please don't let it happen to you. Be safe, be well, and have a great day. And to all you other stroke survivors out there, as I call you my little brain damage buddies, we got this. We got to show people how to survive stroke. We've got to show people that it's not the end of a road. We have some residuals. Some of us hide it better than others. Some of us can hide it. Some of us can't. And for those of you with more serious brain injury or atrophy or inability to use a limb, you have my heart. I understand how difficult it can be, but there's still a lot of good living to do out there. So keep doing it. Take care, everybody.